Hello, and welcome back to Wired for Change, where we look at the people, technologies, and ideas reshaping our world. I'm your host, Amy Yee. Human behavior sits at the heart of many public health challenges, and yet the systems that we design are often assuming that people are rational, consistent, and predictable, and they're not. Today I'm joined by Pauline Kabitsis, applied behavioral scientist who has worked globally across public health systems, including with the World Food Program and UNICEF, which we'll hear about in this episode. Together, we're going to unpack what behavioral science actually means, what's evolving in the field, and what the potential is for public health if we apply it today. Pauline, thanks so much for joining us.
Thank you, Amy. Thank you for having me.
Amazing. I'm going to learn so much tonight. I'm really excited about all the terms and just meaning that we can find in behavioral science and how to apply it. So thanks. I'm so glad that you could come.
Yes, my pleasure.
So for an audience that's not formally trained in behavioral science, how do you tend to explain what it is and what it can be misunderstood to be?
Yeah, so behavioral science is the study of human decision making, and it is the understanding that humans are not robots. We are not rational decision makers. We don't weigh the pros and cons of every single decision. Evolutionarily speaking, that wouldn't actually make sense. And so we rely a lot on what we called biases and heuristics, little rules of thumb to kind of get us through our day and make things easier. Now, when we rely on these rules of thumb, often what happens is we end up behaving in ways that look very irrational. And so, what we say with behavioral science is that it is the study of human decision making and sometimes the seemingly irrational ways that people might behave, but in a predictable manner. And so, we can influence how you might behave in a particular setting, for example, or the choices that you might make based on the decision making context, based on how we place something. So, for example, if you are looking to increase value in a product, and this was something, Amy, you and I spoke about earlier. One thing that we like to say in psychology and behavioral science is that value is not inherent in anything. Value is determined by the market. And so if I asked you how much would you pay for a coffee, you're probably thinking, well, how much do I usually pay for a coffee? And you evaluate the price or value of something based off of that. Now, the question is how do you change people's perceptions of value if you wanted them to pay more for a coffee, for example, pay $30, let's say, which is actually something that a San Francisco coffee company did. And one of the ways that you can do this is you can tell a really big, elaborate story, which is what the San Francisco company did, where they said they went out to Yemen and only got 2 suitcases worth of coffee beans, et cetera. But you can also influence people's level of participation in that activity. So if they did this study, we talked about this before, where they had students basically come into a classroom and they had students make origami, and they were novice origami makers. They made their origami. And then they looked at professional origami, their origami, and the origami of a peer who was also a novice origami artist. And the researchers asked them, how much would you be willing to pay for these 3 pieces? Let's start with the professional one. And not surprisingly, they were willing to pay the most for the professional origami. Then they asked them, how much would you pay for the novice ones, the one that your friend made? And again, not surprisingly, they paid the least amount for that. The surprising thing in this study is that they were actually, when asked how much they would pay for their own origami, they almost paid the exact same amount that they were willing to pay for the professional price, the professionally made origami. So what this tells us is that our perceptions of value change when we think we've had a hand in creating something. So the lesson is, whether you're designing public policy, whether you're designing product, whatever it is that you're creating, thinking about ways that you can involve the user, the end consumer, the person receiving the service, can increase their future perceptions of how valuable that service is to them.
How valuable it is and sometimes how willing they are to adopt it as well when you
Exactly.
look at change management, you
Hmm.
look at involving people in the creation of the vision that you're looking for kind of thing. So really super interesting. And I love how, that also was part of a coffee conversation that we had about my daughter who was actually making origami. during the garage sale. And, it was very fun of you to call her a young budding behavioral scientist, but she was selling origami. And I was, kind of surprised. I was thinking, really, in my head, who's somebody going to buy that?
Hope she's not listening.
She does listen to my podcast sometimes. But I was encouraging her, of course, because I think it would be terrific, and it's completely her idea and her friend's idea to try to sell things at the garage sale. And she noticed that people did buy the origami, but people were much more willing to buy the origami when they saw her making it,
Mm.
which was something that you called operational transparency, I think. And you sent me a study on that. And I thought it was so interesting because we see examples of this elsewhere as well. When you can watch the people who are painting the painting on the sidewalk and then they ask you to pay for it kind of thing. You're part of that experience, and that's another kind of shift in terms of the value that people perceive.
Absolutely. And those are two really great ways. I sort of gave we gave three examples there on how you increase value. You tell a story, which is the Yemen example with the coffee beans. You help build the thing with them, which is the example I gave about creating the origami. That's called the IKEA effect, which is sort of aptly named because when we build IKEA furniture, it's a pain in the butt. But then afterwards, we see high value in it because it took so long and we put so much effort into it. Or you could do
We're cursing and we
yeah,
decided to do it again.
that's true, yeah. Or you can have operational transparency, which is sort of under the hood, what's going on behind the scenes, how much effort was put into it. And so your daughter kind of sitting on the sidewalk there at the garage sale, showing how long it takes to make a paper crane or showing how much effort and thought she's putting into the design of it increases the perception of value then that people have. And so slightly different or nuanced ways to think about behavioral science and psychology, but all with the idea of increasing value. And that's basically to get back to your question. That is what behavioral science is. It is our understanding of human decision making and applying that to influence behavior, whether it's in the right way in either products or in services or in policy.
Mm. And because it's not a simple, straightforward rule that you can always apply to everything either, right? It's something where that has limitations and there are dependencies and nuances to how you apply that. So just telling a story, all the time isn't necessarily going to increase value if there are other challenges with the product. Is that correct?
Absolutely. Yeah. Sometimes you see not people really excited about behavioral science wanting to apply behavioral science right away without understanding how these principles sort of work together, when something might work, when something might not work. For example, calorie labels. Okay.
Okay.
When we were making policy around calorie labeling, the policy was, if you have 20 restaurant chains, you will have to put how many calories are on per item. With the idea that if we educate people more, if we inform them more that Big Mac is not good for them and how much it's not good for them, they'll surely not eat it or they'll change their order. Maybe they'll get a wrap or something instead.
I know for a fact that doesn't always work.
Yeah, and when you actually look at the research and you test it, you learn that that actually backfired in that case,
Oh,
right?
really?
When researchers went in and actually looked at this in New York City, they noticed that when the calorie labels were put on the menus, people actually ended up increasing the amount of calories they purchased. And the hypothesis there was that people actually overestimated how unhealthy the food was that they were buying in the first place. You don't go to a McDonald's thinking, this is going to be the healthiest choice I could make today. You go to a McDonald's knowing, okay, this isn't great for me, but I'm short for time. I am hungry, whatever it is. And then you see the calories and you're like, you know what? I thought a Big Mac was 500 calories. It's only 3. So I could probably budget a Coke or a French fries. And so they actually saw sort of this moral licensing that happened where people purchased more. So it's just really interesting because when they changed the menu labels and they included information on how many calories per meal you should be consuming. So not per day, because when they did it per day, nothing happened. But when you do it per meal, all of a sudden people actually do end up decreasing the amount of calories they consume. And so it is very nuanced, and you really do need to think about when do you apply what? When does something work? When does it not work? And oftentimes it is applied, and we'll get into this, but it is oftentimes applied not to what I call demand type projects, which are looking to you have the structure in place and the infrastructure, and you just need to get more people to do something. And people are really focused on getting people to do something without the right infrastructure set up.
Interesting. And then if we go to the calorie example again, just to dig a little bit deeper, how would researchers go about figuring out whether or not that hypothesis is correct and where things are kind of going wrong?
The moral licensing
Mhm.
hypothesis. Yeah, so what they could have done, they didn't do this in the study, but basically the way that the study worked was that before the calorie labeling went into chain restaurants, they went into those stores. Basically, people ordered, and then they said, "Hey, Amy, can I see your receipt?" And they counted how many calories, were purchased on their receipt. And then the calorie labels got put into place. They went back to those same stores and they looked at people's labels or looked at people's receipts. What they could have done potentially to try to test some of that moral licensing theory is intervene and ask, "Oh, why did you purchase this or that or whatnot?" Now, I'm not sure if they would have gotten exact details on whether or not it was moral licensing, and maybe you'd have to do a lab study to really test that out. But very fascinating finding that you can provide more information, but more information is not necessarily going to change behavior at all
Mhm.
or change it for the good, right?
Mhm.
For the purpose you wanted or intended, which was to decrease people's calorie consumption.
Super interesting. Yeah, and I was just curious about unpacking some of the methodologies that, scientists would typically use to really figure things out if they weren't getting the behavior that they might have expected at the beginning.
Mhm.
So very
A lot of qualitative research comes into play there if you're really trying to understand the why behind something. So you'll do a quantitative type study, the one with the calories, when you're trying to figure out what does calorie labeling do to someone's behavior. And then the why is oftentimes explored through like interviews and some more qualitative approaches to get to that nuance.
interesting. Interesting. And then so in terms of positioning, so where would you position behavioral science with respect to policymaking, for instance?
I think behavioral science is a really nice layer to be added to policymaking. It's a tool within the toolkit.
Mhm.
If we did policy, and it's actually a tool within the toolkit that the Obama administration, for example, recognized. And so they had one of the first behavioral science units in government was during his administration. And it is a methodology to enable for potentially more effective policymaking. And now in Canada, we have some behavioral scientists actually in our own governments. We've got an Ontario behavioral science unit. We have a federal level impact unit, and we've got a behavioral science unit in BC as well. And so you have some scientists thinking about how we might infuse some psychological thinking into the design of our policies so that we're not implementing calorie labels, for example, across the country in an ineffective way.
Okay. And then also we talked about the overlap between behavioral science and user experience research. For instance, how would you think about that?
I think, again, it is a wonderful tool within a user experience toolkit.
Mhm.
A lot of the methodology that user experience researchers and designers use is quite similar, with the nuance from a behavioral science perspective that we are really focusing on the cognitive and psychological barriers at play. And so when you think of user experience designers, for example, they might be more focused on, and this is not true of all user experience designers, but they might be slightly more focused on the logistical components. How many steps are in this? How many clicks? If we're looking at a screen, for example, or if we're looking at a service, how long does it take? As behavioral scientists, we're looking at that, but we're also looking at cognitively what's happening. Is this psychologically difficult for someone to complete? You can actually have services that take longer, like there are more steps, but they're cognitively easier to complete. And so they overall feel easier to do. And so we like to add that extra layer into user experience, which I think makes our approach slightly different.
Neat. Okay, so one last question on kind of the definition of behavioral science. Are there any misconceptions out there that you run into about what it is or how it should be applied?
Yes. So misconception number one is that we are psychiatrists
Mhm.
running around coding everybody into these segments of people and demographics, which is not what we do. There are behavioral scientists perhaps in criminal units that do that, but that is not what we do. One of the most important elements for the field is thinking about moving beyond what we call the I frame, which is focusing only and solely on the individual, and looking more at a systems level approach and thinking more about the larger scale of things. And so I think a misconception is that behavioral science, when it first launched, was really popular for nudges and the impact of small, subtle changes on things that can make a really big difference. And that is true. But I would actually say the power in behavioral science these days and where the field has started to go is looking at more of a systems approach where we're not only looking to influence individual behavior, but we're also thinking about what is the surrounding environment that is the community, the policy, the social norms that are influencing that individual's behavior.
Because there are so many things that influence behavior, aren't there?
Absolutely.
That's a great segue into looking at what's changing in the field of behavioral science. So you mentioned nudges. Could you give an example of, the nudges that people have typically or classically thought of behavioral science as
Yes.
doing?
Yeah. So we can use a silly nudge because I think the field has sort of become associated with these small changes make big impact, and they still do, but I'll give you two examples. And so the silly one, this was in the book Nudge, but I don't have you ever been to Schiphol Airport in Amsterdam?
I have not.
Okay, so well, hopefully you haven't visited the male bathroom, maybe you have. But
The male
in the
bathroom?
male bathroom.
I know I haven't.
In the male bathroom, they were having challenges with men actually aiming properly, and it was just really messy. And so they had a few options. They could replace the urinals, they could put signs up to tell people to aim, men, gosh. And what they did instead is this really clever little trick where they said, you know, from a developmental perspective, a lot of guys learned how to go to the bathroom and aim by aiming at something. There was a Cheerio in the toilet bowl, or there was something that was there. So, what if we put a fly sticker on the urinal? This really, really inexpensive thing, way less expensive than actually changing the urinal or hiring more cleaning staff or printing, messages all around. And that small adjustment led to significant reduction in the amount of spillage and kind of grossness of that bathroom. And so that is a very silly example of a nudge, but it did popularize and it was the field. And it was put in this book called Nudge by Cass Sunstein and Richard Thaler, who won the Nobel Prize in behavioral economics. So sort of a kind of silly example, but then on sort of a real life example, nudging has been highly effective to increase people's retirement savings. And so when you think about getting people into saving for retirement, the reason it's so hard is it's because it's for a future you. Thinking about spending money today and all the things that I would like to buy in the moment is far more satisfying than saving my money for a future moment in the future. And so people don't do it. And so a nudge that researchers did very early on was to actually change the registration for retirement savings. And so when you went to an employer, instead of having to check the box to say, I opt in to a retirement savings plan, to a 401k plan, you actually had to check the box if you did not want to be in it. So everybody was automatically enrolled. And this slight change in the design of the form resulted in a massive increase in the number of people who ended up saving for retirement. Now, again, this is the challenge with nudges because further on, when they actually looked at the longevity of this study, yes, they got more people enrolled in retirement plans. But over time, because they were defaulted into a retirement savings plan, people stuck with the status quo contribution rate, even though their salaries were raising. And so the hope is that as your salary goes up, you kind of increase the percentage amount that you might be contributing, which did not happen. And so over time, you did not see the change that you would like to see, but you got more people in the door saving for retirement. And they did this also with organ donation in many countries as well. And there were some studies actually in Canada on organ donation too. So these are the types of examples I mean by nudges. Very inexpensive changes to the design of things, whether it's the form, right? Check it or don't check it. Whether it's the urinal, put a sticker on, don't put a sticker on, but have massive impact on scale.
Absolutely. I'm really struggling now because I have two questions that I want to ask. Okay, so I'm gonna ask this one while we're on it. Okay, let's move to the systems kind of side of things, right? So you mentioned that it's evolved from being about nudges to being more about systems perspective, and maybe other things as well. So maybe you could tell us a little bit more about how things have evolved over the last 5 to 10 years.
So we've moved away from, we still do nudging because there are still subtle shifts that you could make to the design of your forms, to the design of your website, to all sorts of things that can still massively drive impact. But we've started to also think about the surrounding context and environment. And so we've moved away from models that we used to use, the BJ Fogg model, for example, which focus very, very heavily on the individual's behavior. And we've moved into other theoretical models that help guide our research. And then that research informs the type of programs that we might design, for example. So we started using the COM-B model, which stands for capability, opportunity, motivation, and then the B is behavior. Or we started using the behavioral drivers model. These models look at individual behavior, but then they also talk about social behavior, communities, institutions, policies. And so what this looks in practice is it looks, if you're trying to change nutrition habits, for example, if you were to do a nudge, you would probably just change the placement of the food, right? And they did this in cafeterias and hospitals in Boston. They just put more water bottles near the cash register. They made apples more accessible than the Kit Kats, and all of a sudden people were eating healthier. This is a nudge. If you wanted to change nutrition perhaps more largely, holistically, you might actually have an entire program, which was something we did in the Mozambique project with the World Food Program, where you don't only have a change to the market or the grocery store where people are purchasing their food items, but you also have support in the surrounding environment. You have communications telling people what is healthier for them. You have cooking classes or ways to teach them how to incorporate that healthy food. And so you have various components to that program to change behavior instead of just one small slight shift in one place.
And when you're starting your research, how do you identify that and plan out all the different components that you're going to look at? Is that the application of a model?
That's the application of a model. Yeah. So in each of the models, they sort of outline different areas that you should be looking at. And you sort of, as you're developing whatever tool you're using, whether it's a survey or qualitative research discussion guide, you're trying to hit all of those points to make sure there's no stone left unturned. You sort of looked at policy, you've looked at the environment. And so, for example, I did a project in Syria, and this is behavioral science applied to the wrong thing, where they said, we want to encourage healthy COVID-19 mitigation measures. This is before the vaccine came out, things mask wearing. And then you find out, well, there's actually a really low supply of masks in the community. And so, how are we going to encourage the uptake of masks without masks? This is less of a behavioral science problem and more structurally, you have to fix that. But then we took a more holistic, systematic approach and we said, well, how do we increase the supply of masks then? Is there a behaviorally driven way where we can encourage people in the community to use the resources that they have available to them to create masks, right? The fabric that's there and make masks. And could this be a circular economy thing where then you're employing the women and they're making the masks and then we're using other behavioral techniques to actually encourage people to wear the masks. And then you start thinking more broadly about the entire system as opposed to just the one thing of put on the mask.
That's so important because so many systems that we have are, built to be kind of self-reinforcing as well. So if you only change the one thing, against the entire system that exists, it's kind of hard to imagine that it will actually change or that you'll have sustaining
Yes.
kind of change over time, right?
And that's one of the criticisms that you saw in early behavioral science, that there wasn't sustained behavior change. And I think that's one of the reasons the field has started to move toward a systems approach to enable some of that sustainment.
Interesting. And, so anytime there's something that is powerful and you're able to apply it in a way that, changes behavior, I mean, you have to question the ethics as well, right? A
Hmm.
little bit. So how do you think about, ethics and equity and all of those things? Because there's no guarantee that whoever is using behavioral science is going to be using it for quote unquote good, right?
Yeah, yeah. It's sort of that Spider-Man quote. It's with all that power comes great responsibility.
Absolutely.
You have to think a lot about when you're applying or changing behavior, who is it going to hurt? What is the worst case scenario if this were to happen? I think a lot of behavioral scientists play that out in their head. You also try to understand, is this getting someone closer toward a stated intention? So something like organ donation, for example, most people when surveyed report that they think that it is important to donate their organs, that if in a life or death situation, I think it's something like 80%. This is based on an older study, so the numbers may have changed. But at the time when they did that study, it was something like 80% of people said, yeah, I think that you should donate your organs if something happens to you. And then less than 2% of the population is actually doing the thing. And so I think in circumstances like that where you have a very clear evidence of what people actually want to be doing, you can think about ethically, that seems the right approach. We're getting people closer to the thing that they wanted to do in the first place. It becomes a gray zone when you're getting into business requirements and business needs where we want more conversion, we want more uptake of this or that. And that's where we really have to think about the guardrails. When do we say yes to a project? When do we say no? Also, how do we make sure that users or consumers can opt out at any time? And it's really easy for them to do it. We call this sludge. It's when behavioral science is performed or applied in the wrong way, when you're adding frictions to make a behavior harder to undo. So you're kind of tricking people to do something, tricking them into an annual subscription and then not allowing them to cancel their subscription when they get defaulted into it. It's when we're doing behavior change, we often always try to think about, is this helping the majority of people attain the behavior they wanted to do? And are there guardrails in place that allow them to reverse it or opt out at any time?
Thank you for that. And then I guess, if you take it one step further beyond that, you could look at things social engineering that is used by bad actors, for example,
Mm,
and and with phishing and other kind of ways that they're trying to
yes.
influence people to do something that can be quite harmful. It's not just creating friction for something that they want, but it's actually harmful to them. Is there any use that you've heard of behavioral science to look at that and maybe to support kind of the opposing kind of idea to that?
To
Have
help
you ever
people
seen that?
sort of not for phishing attempts and that sort of
Yeah,
thing.
yeah, or to get beyond social engineering in some way.
Yeah, this is the really hard part because social engineering really pulls at the heartstrings. They have such great ways to try to get you out of your rational thinking. We call
Mhm.
that system 1 thinking and into your system 2 thinking, which is highly emotional, very irrational. And so I think that there's some places they've done this. So for example, a project that was done with Irrational Labs actually with TikTok, they looked at reducing people's time between reducing misinformation spread.
Mhm.
And so one way they did that, sort of similar to a phishing attempt where you don't want people sharing information too soon, is that they introduced pauses in the experience. And so before someone went to go share a video, it actually had a pop-up message that was, are you sure? 80% of these tend to be misinformation, or don't share something that you're not 100% certain about. I can't remember the exact messaging, but
Mm,
introducing the pause where people can actually try to get back to that system 1,
neat.
pause, reflect, see if this is a real threat or not, can be beneficial and helpful when you're being exposed to something like a phishing attempt.
Super interesting. Great example. Thank you. Now let's move to sort of making the connection to public health. What do you see as kind of the untapped potential for behavioral science and public health, at a high level maybe? Or just
I
something that inspires you even?
I'm highly inspired by I've noticed this especially in the work that I've been doing in the development space where they are moving beyond behavioral science. They call it in this space social and behavior change. And when they first started doing it, they called it SBCC, social and behavior change communication, which means all of their behavior change techniques were just communication, which I just earlier told you is not a highly effective strategy. Just telling people is not really going to move the needle on people's behavior. And actually, often more times, information is not that helpful. It increases awareness, but if you want to change behavior, actually, you should probably focus first on making the process easier, for example. And so, what inspires me is that I'm starting to see organizations, this really large, sometimes bureaucratic, legacy kind of organizations, start infusing some of these more innovative strategies around move behavior change. How do we rethink our system so we're not just communicating, this is how you follow the process to do this, but we're actually just making the process easier, or we're getting people to do less steps and so forth. And so I think it's just been inspiring to see the field grow in these more legacy organizations.
Nice, nice. That's super interesting. Hmm. So, what was your first exposure to how behavioral science could help in public health?
Oh, yes. My very first exposure to behavioral science and public health was a project that I completed in Ethiopia on birth registration, birth, death, etc. registration. And it was a really fascinating strategy that was developed for the government of Ethiopia to think about what are some of the barriers or reasons why someone might not actually want to register a birth? And also, what are some of the benefits? Why would someone take time out of their day in this really long, arduous process? And for many people, they travel many, many kilometers to go to the office to do this registration with a crying newborn baby. What is the promise in return for these people? And it was the first moment where I really realized, oh, this is a new way to think about policy making and to think about behavior change, where you're not just creating policies in a vacuum where it's important to, register a birth, for example, but you're thinking really about what are the things that might cause our user not to do this, might cause our citizen not to do this thing, and how can we make it easier for them and infuse that into the way we deliver that policy. Maybe it's not changing the policy, maybe it's moving the office to be closer to the community where those births take place. Maybe it's first day of school. If kids don't have birth registration, they can be enrolled, or their parents can come and fill out the right documentation. And so it allows you to get really clever around the types of solutions that you might be able to bring forward when you start really understanding the consumer, the end user. And that was my first sort of foray into behavioral science for global public health.
That sounds really exciting.
Hmm.
Good for you on getting that experience as well. Was there anything that surprised you during this process?
COVID hit. So that was a big surprise. So it kind of cut the research short. But I think it surprised me to see how open and willing the government seemed to be to kind of implement some of these strategies. I thought it was going to be a much harder sell than it was, which was really nice to see.
Oh, that is interesting.
Hmm.
Does it tend to be a hard sell? Where do you find it to be a hard sell and where not?
I think it can be a hard sell in policy because it really flips a lot of the assumptions that we had on its head. We'll ask, well, why do we do it this? And people go, well, we always did it this. Why would we do it any other way? And we'll, well, because I don't think this is the reason why. And it takes a really brave leader to be willing to test new, innovative ideas that sometimes might fail. You might actually not have a solution that does work. You had strong hypotheses and then you tested it in field, and it turns out that it didn't have the impact that you thought it would. And it takes someone with a lot of leadership and clout to actually take on something like that. Whereas if you're never testing things, you can't fail. And so that is the tricky part with behavioral science, because we're big advocates of testing our ideas, which means sometimes it works and you look a superstar, and sometimes it doesn't. And people view failures far worse than they view successes.
Yeah.
And that can be very challenging, despite even though failure is really teaching us something about a lot of things and it can actually be quite beneficial.
Mm-hmm.
The way that we perceive failures as a community, and this is part of the reason why in our field, you saw that there was a replication crisis, they called it, where most of the papers that were being published academically were focused on positive outcomes. Everything was working. And it's because we're awarding the successes and we're hiding the failures. And so that can be the trickiest thing, is finding leadership and finding people who are bought in enough to say, I'm willing to test out these ideas and see if they work.
Right. And then just because something doesn't work, what can we learn from it? It doesn't mean that behavioral science doesn't work. Just
exactly.
That piece didn't work, kind of thing.
Totally.
Interesting.
Yeah. There's lots of things we do that don't actually work, but we don't know because we never measure them. We don't test it.
That's very true. Is there any tension between, academic rigor or the rigor of, the science itself and sort of the urgency of applying something or just rolling it out?
There is. If you have a fully academic team, sometimes they will be very focused on making sure that this is up to a certain standard so that it can be published in a peer-reviewed journal. And I think sometimes we have to sort of ground ourselves in, and that's why we say applied behavioral science, because it's not going to be the perfectly designed study. Your goal is to design something that you have strong hypotheses and beliefs that it will work, and measure it somehow. Is it going to be gold standard, beautifully designed randomized control trial? Probably not. It's very hard to do randomized control trials in field, especially if you have policy that needs to go out quickly or customers or clients that are launching a product soon. They're not going to wait for your 1 year RCT to then tell them what to do to the product, and then they have to make those product changes. And so it is a fine balance between when do we have time to really rigorously test this? When should we rigorously test this? And when is it like, this doesn't really need to have a 6-month randomized control trial with 2,000 people in it. We can probably, stress test this before launch, gain some learnings, and iterate. And that's it's the analogy of working in an ER if you were a doctor. You apply the best medicine or science when somebody comes in based on your knowledge. You wait until they're stable, and then you learn from that and you iterate and you improve. And so that is, as applied behavioral scientists, what we strive for, trying to get to results as soon as we can based on the knowledge and information that we have, and then improving as we go.
Okay. Thanks so much. I know we've jumped around, but I think you've really helped to give shape to what behavioral science looks today, applied behavioral science looks today, and where the push and pull is of it. So thanks for that. Tell us about the World Food Program work that you did, starting with, just a level set on what the challenge was that you were trying to address.
Yeah, so this was a really interesting project. It was a project in Mozambique where World Food Program has a program where it's called Cash for Prevention. And basically the way that this program works is that they give food vouchers or food itself to help families, low-income families, eat and afford food. And in Mozambique, in Cabo Delgado, where this study took place, where this program took place, there were high rates of malnutrition, especially among young children. And this is despite the fact that World Food Program is handing out these vouchers. And so they brought in a team of behavioral scientists on behalf of myself and a company called Anthropologica and asked us, what's going on? We're giving people the means to purchase nutritional, healthy food for their children, and we still aren't seeing nutrition improve in this community. And so Anthropologica is a group of anthropologists who went in to actually study the behaviors of people in this community and understand what it was why they weren't using this cash from the World Food Program. And it turns out they were, of course, using this cash from the World Food Program. They're cashing in their vouchers every time they get it. But they're cashing them in to purchase non-perishable items. And the reason for that, we learned when we went in field and did this research, is that because they weren't sure when the next voucher was arriving. And so if you're in a food insecure area and you're trying to support and feed your family, you are looking for food that's going to last you a very long time, that's not going to go bad, and that in many cases makes your kids feel full. So things rice, things cassava, things pasta, these things, are they nutritionally healthy and balanced? Absolutely not. But I know that I can have these, for 6 months, and my kids are going to be fed and their tummies are going to feel full. And so that was what we learned was going on. It wasn't that people were not using the vouchers. It was that they were using it to purchase things because they didn't know when the next voucher was going to come. And so the question was, well, how do we get people to purchase healthier nutritional foods? And one obvious answer is tell people when the next voucher is. But we also knew that just telling them when the next voucher was is not going to be enough, because many of these communities or the people in these communities are not familiar with using these products. If you've been food insecure for most of your life, you are not familiar with buying kale and then how you use kale in the existing dishes that you make at home. And so we had to think about how do we very cleverly incorporate nutritional food into the food of these homes. And something that was really interesting that, when you look at it in hindsight, of course, but when we were designing this program, originally the intention was we're going to make these net new recipes with chefs in the country. And then we said, hold on a second. If we make a net new recipe for this community who's already probably has low cognitive abilities in terms of they're already stressed enough trying to make a living, now they have to remember an entire recipe. And we know as humans, we have limited memory. We rely on our habits. I cook the same thing every week. I barely, if I'm following a recipe, I have to have the recipe book right in front of me. Otherwise, I'm doing my routine. And so we said, instead of, forcing people to learn 10 new recipes, which is going to be really overwhelming, let's learn what they're already cooking at home with the non-perishable items that they already use. And let's think of clever ways that we can now incorporate some of these more nutritional items, kale, into those dishes. So now, instead of getting someone to remember an entire recipe, they just have to remember to add kale at the end.
Right.
It's much, much easier for them to remember it in the moment. It's much, much easier for them to justify purchasing it because they know when their next voucher is coming. And then we had lots of other kind of nudges then that were paired on top of that. So a nudge being the voucher card that they used signaled to them how much of that voucher should be spent on vegetables and fruit versus how much should be spent on non-perishable items and so forth. And so you could visually see, oh, I should be spending about, 25% of my allocated money to fruits and vegetables, for example. And so this was just a very holistic program. We had two more elements in the program, one which was a cooking school. So not only are they learning how to infuse a few of the new ingredients into the things that they're already making, but if they participate in the cooking school, they get a certificate that shows that they participated, and that certificate actually helps with employability at restaurants around. And so we really thought about the system level, not only if we thought only about the nudge or one element of the program, then we would have just sent text message reminders to these communities, because a lot of them have cell phones, saying your next voucher is coming in 2 weeks. But we wanted to make sure that this was a sustained behavior change. And so we really thought about the entire house, the community, the house. How do you motivate people to purchase the thing? Then how do you make sure that they use it at their home? And then how do you make sure that they know how to use it? And how do you motivate them to learn how to use it? You give them this really nice reward of this actually helps you get employed elsewhere to help them support your family. So just a really lovely example of a systems approach to behavior change.
Such a moving and relatable story based on, that very basic need of having nutritional food available to you and the fact that not everyone has that. And I love the way that you addressed all the different facets and in different ways and evaluated how all that would come together. It's so interesting. And then, so was there were you measuring outcomes as well of the project?
Yeah, so the project is actively in trial right now, and we have not seen quantitative outcomes as of yet. But analogously and qualitatively, we have heard reports from our team members on the ground that people are purchasing more of these nutritional foods, and that there are less kids coming into the MUAC screenings, which are the malnourished screenings.
Wonderful. Wonderful.
So we'll see when the quantitative data comes out, but it sounds promising.
So it will be coming out at some point.
Yes, yeah. And when it does, Amy, I'm happy to
Oh, come back.
update you. Yes, please. Yeah.
Come back and tell us the rest of that. That'll be great. And was there anything, and maybe it's in the telling of this story, but was there anything that it helped to reinforce with respect to, designing with communities as opposed to for them, for instance?
I think the reinforcement that was a big aha for the World Food Program was that moment of, wait, why are we making entirely new recipes? Why don't we just use the recipes that they already make and just add a few things? And I said it in hindsight, it sort of sounds so, of course you would do that. But when you're thinking about designing an entirely new program, you're excited, you're ambitious. And so you don't actually sometimes consider some of those more obvious steps. And that happens a lot, especially in the global development space. There's an example with fire stoves in India. And these Harvard researchers designed these, basically women in India, they cook indoors on these stoves, and the fumes are so toxic that it's having 12 packs of cigarettes a day. They're just constantly inhaling this smoke while they're cooking. And so these Harvard researchers and engineers designed this new portable stove that would have way less fumes, be way healthier for these communities. They gave them to the communities, they have to buy them. And then again, people aren't using them. And so the question is why? And one of the reasons is because this stove wasn't designed with the community. Yeah. And they learned that one of the reasons people weren't using it is because when it broke down, they're using it at first, but eventually you've got to get more firewood or whatever it was to kind of reheat the stove. And that wasn't a task that the women typically did. And so they needed the men to do that. But the men were so busy doing work and so forth. And the kitchen cooking was the job of the woman that they never ended up, cutting that wood or whatever it is that they were supposed to do. And so the stove just became irrelevant and they went back to their old ways. And so these are small little things that if you don't design for the community in mind with the community, it just can't be for the community in mind, but you actually have to build it with them. You're probably missing key things that are going to drastically influence the uptake of your program or your service.
Thank you for saying that. I did way back, I did a little bit of work with Engineers Without Borders. And, I know that different teams from different countries would have different approaches. And there was a big difference between the teams who would come in and just, design for the community and drop down with their new solution. And I understand that impulse. You said, when you start a new project or you've got a new initiative, you are really excited and you want to come up with a solution and give it to them and save the world kind of thing. Right?
Totally. Yes.
I completely
Yeah.
get that. But it was the teams that had an approach of really designing with the communities that had the most success and the best adoption. And so it's something that, you see over and over again, but it can still be hard to do, or it's still not, common practice all the time, right? Sometimes there are other things
Absolutely.
into play. So I just love the way that you told that story. So
Yeah.
thank you for that.
And to tie the loop on that, what is one of the other reasons why designing with the communities is so important? Probably a part of that IKEA effect.
hmm
They're building it with you. They're building something, so you feel more pride in it afterwards when you see it kind of deployed in your community.
Absolutely. Absolutely. Nice. Okay,
There you go, full circle.
let's go to the UNICEF story then. Tell us about, that project as well. And I could sit here and listen to you talk about your project
Yes,
all day long.
yeah. This is another really interesting project, very, very difficult and challenging project. This was focused on migration in El Salvador. So, migrants coming from South America, either from El Salvador or elsewhere, and transiting up mostly to the United States,
Mhm.
and mostly doing this illegally. And so the question is how do we try to make this a little bit safer for people? We know people are extorted on these journeys, that things do not go as planned. And as UNICEF, their goal is to protect children and adolescents. And so if we know this is going on and we can't stop it, how do we as an organization help sort of at least improve it a little bit and try to get more people to have a safer journey if this is something they're going to be doing anyway? So really, really tricky because there are so many things that go undercover in this sort of scenario.
Right.
And we learned this firsthand when we sort of applied the methodology that we often use in research to this particular project. So our methodology for research, similar to, again, this was a project done in partnership with Anthropologica for UNICEF. And we went in, myself, the anthropologists, and we thought, well, we'll just show up at the border and we'll ask legal migrants, what they plan on doing for their journey. What do they need? Why are they moving? Da, 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 da. Well, it turns out when you show up in a t-shirt that says UNICEF on it, people are not gunning to talk to you if they're illegally crossing a border.
Mhm.
And so we learned very quickly that we needed to change our approach. And we ended up, but we still wanted to learn about communities and what they needed, right? We're still trying to design for and with them. And so we ended up actually, and kind of sadly, but this is the only way we could really interact with these communities, is for the migrants who got returned. So people who actually made it, all the way to the US, often they claim asylum or they got caught in the US or whatnot. They didn't have their papers and they were sent back to their country. And it was at that point where we could actually ask them a bit about their journey, and they were more willing to share about it, more willing to share about the things that they wished they had known but didn't know. And this really helped us think about how do we help set up other people who are going to be going through this journey to help them understand what this might entail, help them gain lessons from what these people went through. So one of the things that we learned in the design of this was they often leave their homes in a hurry, in a rush. There's been some sort of threat in their home community that causes them to basically pack up in a not even a suitcase, in a backpack, and just go. And so they often don't have all of the physical things that they need. They don't have sunscreen, they don't have the proper shoes, they don't have water. And UNICEF knew this, so they had these kits that they were giving at the border, but uptake of them was variable at best. And this is free stuff. So you would think that people would take it up completely. And one of the things we learned when we saw the kits was that a few things. One was that it was massive. And if you think about someone who's traveling by foot, you don't want to be carrying something as large as that. It was very difficult to carry. So it didn't have a handle. It was literally a plastic bag, almost a garbage bag, but it was transparent, tied. How does someone carry that? They'd have to put it in their existing bag, but do they have space in their existing bag? Probably not, because they packed their whole life in that bag.
Yeah, it would have been full, right?
And so it's okay, well, we need to redesign the bag, but also what items do they need in this bag? And when you looked at the items that were in the bag initially, it was a whole swath of things. It was like diapers and tampons and sunscreen and really big Colgate toothpaste. And our main hypothesis was people probably don't need all of these things. They might need one or two of these things, but maybe, and some people might need different things, right? Some people are traveling with a baby, they need the diapers, but the person who's not traveling with the baby, they don't need the diapers. And so if you bundle the diapers with it, maybe it just lowers the entire value of that kit altogether and they don't take it up. And so one of the things that we did to improve uptake of those kits is we created more of a marketplace. And we set out, here are all of the items that we learned through our research that are valuable to have on this journey. Here is, sunscreen, here's small toothpaste, here's a map of where existing shelters and places you can go to that are safe spaces. And we changed the way that people could adopt those packages. So initially, they had to write their name down to take a kit. And of course, if you're trying to remain anonymous, you do not want to write your name down. And you could say, oh, you can be clever about it and just write a fake name. But I think, people get really worried. They're already transiting through a country legally. They don't want to have any cause for concern. They don't feel lying. They don't have the mental capacity to think of another name. There's so many different reasons. So that is just an added friction point that you don't need when you're trying to provide supplies and support. And so we just removed that. Where let's just allocate, if this is for measurement purposes and you want to know how many people took up kits, we're just going to put numbers. We're just going to, number one took a kit, number two took a kit. And we're going to allow them to build their own kits. So we're going to say you can pick 3 items out of all of these items. And this increases the transportability of those items. But it also increases the feeling of value and ownership over those things because they're picking things that they're actually going to need. And then we were able to pair those 3 things with a nice little easy to transport bag that had really key critical information about those safe homes, et cetera, that they wouldn't have received otherwise. The last thing we did is we made sure those bags didn't have any branding on them. Because we learned through our work when we went in field for the research that having the big brand on your chest is not the right approach. You don't want to see, it's a very obvious signal that these are all legal immigrants if they're all moving through the country with a UNICEF bag, right? So we also ensured that there wasn't large branding on this bag, that there was no branding on it. It was easy to carry. It had only the 3 items that you got to select to increase ownership, and it had additional resources in there that were meant to help you along the journey.
Wow. That's a lot of things because you've got process changes, right, with the names versus the numbers, for example, and then you've got the changes in the things themselves, and then you've got so many things that fit together. I'm curious, is this typically an approach that you do iteratively, or is it more of a kind of a big bang? Well, we've looked at these 10 things, and we think we should change all of them and try it, or is it something where you're changing one thing at a time?
And I think oftentimes one thing at a time is easier. In the case of the bags, we changed all of those things at once, but they are iterating on it as they go. And so, as they're seeing what things get taken up a lot more of, they're restocking that more quickly and they're removing things that maybe are less taken up. And so they are still right now iterating on the way that this kit system works, how they even distribute information. One thing that they recently added, which was not something that we did with the kits, but I think is really nice, is how do you get people to come over to this marketplace and pick up things? They give free Wi-Fi. So the incentive, it's sort of interesting. You cross the border or whatever. It's a place where a lot of people end up crossing. There's free Wi-Fi, QR code label thing. And so people are going there to get Wi-Fi and communicate with their loved ones that they made it so-and-so here on their journey. And while they're there, there's all these great things that they can pick from and that sort of thing. And so they continue to add to it, which is really nice, but it is, I would say it tends to be more iterative than it is, here's your package of things. We often say, here's maybe, the first 2 things that you try and then maybe add this, or you learn from it and then you change it.
Nice, nice. And when you're working on projects like this, is there typically a hard goal or, that you're trying to hit? Or is it, more of a let's, turn this around and just make it more positive and see if it works kind of thing?
There's always a hard goal. So we call them, we have outcome measures and KPIs, and then we have what we call behavioral objectives. And so I'll give a very easy example of this, which is if you're trying to win the hockey game, right? Canada, the boys are the Olympics, they're here. Their goal is to win the gold, right? And so that's the outcome. We want a gold medal. The behavioral objective is, what are the behaviors that we need people to do before that outcome is achievable? And the behaviors are, they have to go to practice every day, or they need to be eating these types of foods to gain muscle mass. And so we establish what both of those things are. What are sort of the interim measures that are going to tell us in the short term if this is successful? And those would be things, did people take the bags up? And then what are sort of the longer term goals and, outputs or the KPIs? I think for something this type of project, it's hard because people don't want to be tracked.
Yeah.
So you can't necessarily see, was there a reduction in the number of reported cases of abuse, for example, at these shelters? But you can look at things, were there more people that came to the shelters after we distributed these kits? And so it's not a perfect science, but we do set and establish behavioral objectives and tie them to outcomes at the very start of the project. And then all of the activities and solutions designs that we create are in service of achieving those objectives and eventually those outcomes.
It must help that you're so experienced so that you can sometimes, go in and set expectations a little bit.
Yeah, totally. Sometimes we will not get that in 2 months. This is the small interim thing that you will see.
Right.
And that's a good sign. It means you're in the right direction, but you won't see. And that's a perfect example with nutrition too. You're not going to see malnourished kids all of a sudden become extremely healthy in the first month of your intervention. It takes time. It takes consistent sort of feeding practices for you to see the fruits of your labor per se. So yeah, it's important to have those interim behavioral objectives to make sure you're on track.
For sure. We talked a little bit earlier about kind of the things that, you need to have as the stakeholders or the leaders who are, engaging in sort of bringing in behavioral science teams, for instance, to help make a change. Could you just mention a few sort of, qualities in terms of maybe it's the mindset, for example, that helps to make this successful from that leadership perspective? And then what I'm going to do is I'm going to ask you from the, the applied the people from the perspective of the people who are applying this or who are engaging in asking these questions and trying to figure out what works. From your perspective, what are some of the qualities that would make someone successful at something like this? So let's look at the leadership first.
So for leadership, what we find, and it's a bit of a selection bias because the people that tend to bring behavioral scientists in right now,
You got me. Yes.
but they tend to be a little bit more open to risk, a little bit more excited and interested about psychology and human-centered design and infusing principles of let's involve communities in the development and design of these things. And so I think as a result of those people being driven to behavioral science in the first place, you see much higher levels of impact or success because you have a stakeholder who already feels very strongly about this type of work.
Fair enough.
You see on the reverse side, you do see critics of this, and it's important to have critics always of a field. I think one important element of what we do to silence the critics, but it is to measure, is just to say, look, and I actually do think this is the way that you bring equity into any design process. If you're not measuring things and you're not getting people to sort of suggest, and sometimes even anonymously, when we're designing things, we don't have people add their names to it because we don't want to only pick the CEO's ideas or the community leaders' ideas. We want to make sure that everybody has an equal opportunity to share an idea that could potentially be the thing that gets implemented.
Really important. Great. Thanks. Now, in terms of, patterns that you see in people who are great at doing this kind of work, if I was to, encourage my daughter to get into behavioral science and to solve giant problems you're doing, what kinds of, qualities or mindset, tend to be helpful?
I think a mindset to constantly be learning, which is true of many fields, but it's really true to question things. We don't take things at surface level. We really say, well, why would that be designed this way? Or why would someone do this instead of this? And so I think constantly sort of questioning the environment is a really important step for any researcher. And it's probably the key thing if you're a behavioral scientist, it's the key skill that you want. If you have strong research capabilities, then all of the other things will come. But if you've got this knack for trying to really dig into, it's a 5 whys. I'm not just going to accept your first why of why you do something. I'm going to really try. I'm going to ask you 4 more times to get to what I believe is a behavioral truth, the real reason as to why you might be doing something. And in that case, I might not even ask you. I might actually just watch what you do. I might put, something here and something there and kind of see what you go toward. And so I think just being really curious, asking why is one of the critical elements of being a really good behavioral scientist. And being okay sometimes with things not working. One thing that the field has gotten really good at recently is because of that replication crisis that I was talking about earlier. Now there's pre-registration, so you can actually put your study up and have other academics critique it or just be more honest about what your methodology is without you being able to change it kind of thing. There's mega studies now, so you're actually seeing lots of really big in-field randomized controlled trials run by academics. Katie Milkman is a perfect example of this. She's running really cool, massive studies throughout the US with big companies, Walmart, or with government. And these people are all just questioning the status quo. They're just saying, well, what if we tried this and see if it works? And so, yeah, that would be the key thing. Try things, question things, and measure it.
Exciting. And so when you look at, what you've done already, and then you look at the public health challenges that you've seen or been exposed to, describe for me what we think the potential, is for behavioral science to help.
I think there's potential for it to continue to grow into a variety of fields. So we're already seeing it extend its tentacles, if you will, into places. It's very popular in the tech scene in the US. In Canada, it has been most popular, I would say, with our banks and in finance. And so the opportunity, I think, is to continue expanding the fields in which behavioral science is a tool within the toolkit and continuing to publish the findings of our results so that we can update our knowledge base on how people's behavior works in different contexts. Because if there's one thing that is true about behavioral science, it is that context matters. And what you do in one place, there might be a heuristic or bias or principle that we say, this typically happens here. That actually might not apply at all in a different context. And the only way we're going to know that is if we're consistently sort of sharing that knowledge with other people in the space. And so there's just an opportunity to continue sharpening our tool and also expanding the places where it's applied.
Nice. Do you have any advice for people who are out there who might be thinking, oh, how do I try this out?
Yeah, there's
organizations.
Great. I would encourage you to try it out. It is such a fun way to think about the world. There are some really great introductory books on behavioral science. One of my favorites to recommend is Predictably Irrational by Dan Ariely, because it's just such an entertaining read about how he applies behavioral science in his own life and how his life curiosities sort of triggered a lot of the research he ends up doing. There's lots of books on habit change by Katie Milkman, for example, that are really interesting. So I would start by just reading some of these more airport books, if you will. They're sort of pop culture books, but they're really fascinating and it starts getting you to think a little bit differently. And then if you're super keen and let's keep going down this path, there's lots of online courses to pick up the skill and sort of learn how to use behavioral science in your work. Or sometimes the best way is to work with another behavioral scientist and see how they work on a project and how they might think a little bit differently than you on something.
Do behavioral scientists tend to be very social creatures?
It really depends. No, there are some very introverted, more research, what your stereotype of a researcher would be. I definitely sit on the more extroverted side of things, but there are certainly a broad spectrum of people, which is really actually quite fascinating. Yeah, you see everyone. And some people are great at different skills too. Anything.
Anything. Do you have any tips for, people within organizations who are either thinking about building their own team versus bringing in external consultants?
So I actually have a report on this with Gavi, the Vaccine Alliance, and with the World Bank and WHO on how to build a behavioral science unit and what types of questions you should be considering if this is something that you want to do in your organization. I think that if you're building it in-house, the key lesson from a lot of behavioral science units who have done this in the past is to start small, get quick wins early. Sometimes what that looks is nudges, show impact, and then you're able to get more funding. There are also lots of nuances to this. How big is the team meant to be? What types of projects should you take on? How do you get those projects? But it is a massive investment, and it is very challenging to sometimes find the funding for behavioral science units within house. And so some of what we're seeing is actually a transition away from there was a big buildup of behavioral science units in organizations. And I would say now you're sort of seeing a threshold being hit, some behavioral science units being dissolved in-house, for example, and more consultants coming in and helping infuse behavioral science with marketing teams, with product teams, that sort of thing.
Okay, interesting. Now you're doing this work now. Can you tell us a little bit about the focus of what you're up to?
Yes. So I split my time. I am a consultant and I split my time. I run my own small little boutique consulting firm out of Ottawa that works on behavioral science in two ways. And I work on it in the global health development sector, which were the examples that we heard about World Food Program and UNICEF. And then I also work on it in the tech sector, which were some of the examples that you heard about with Irrational Labs on TikTok and that sort of thing. And so I split my time on these two projects and really focus on helping teams drive change and measure that change using psychology.
Nice. It's such a great kind of wired for change.
Yeah, yeah.
kind of fit. I appreciate that. What are you most excited about moving forward?
Ooh, excellent question. What am I most excited about?
It can be one of the top 10 things because you seem pretty excited.
I know. I'm a very excitable person.
That's a good thing.
I think just there's some interesting 0 to 1 type of projects that are going on now with behavioral science. So behavioral science used to be brought in at the end of things. Product has already made decisions about what the product is going to be. And then they're like, oh no, people are dropping off here, or the service is not being uptaken. And then they'll help fix it, behavioral scientists. And now we're starting to see more organizations actually say, we're thinking about building a new product, or we're thinking about creating a new service for citizens. What should we build? How should we build it? And that I think is really exciting because you're starting to build in behavioral science into the vision and at the onset of the product development, which allows for way more sustainable behavior change than if you bring people in for sort of a Band-Aid type of fix approach.
Nice. That is exciting.
Yeah.
Is there, anything else you want to tell us about your philosophy or approach that might be different or unique?
Test, think about the psychology of your consumers, whoever you're designing for, build it with them and test the thing. And I think a lot of the times we jump to assumptions too soon when we're designing, or we rely on the heuristics we have of this always works, so we should just do this. And the reality is when contexts shift, what always works does not always work. So if you can just be consistently thinking about your consumers and the psychology behind their decisions, not just the surface level things that you see, then you are setting yourself up a lot more for success in the future.
Absolutely. The story behind the story kind of thing, right? Fantastic. Well, I've really enjoyed all the very powerful stories that you've told in such a clear way. It's such a delight to speak with you and to learn from you, Pauline. And I hope that there's another opportunity to come back and look at, where you are, in the future and what outcomes you've seen and what other projects you've worked on, because it's truly fascinating. Is there anywhere that people should go to connect with you or to learn about your company?
Yes. So if you'd like to connect, I am absolutely on LinkedIn, and we have a website in the making coming soon. So keep an eye out, but we've got a LinkedIn page called Decode Behavior.
Amazing. Thank you for that. Really great to look at, some of the tools and thinking that can help drive change when we're talking about being wired for change and what that means. So thank you again for coming today. And for listeners, I hope that you enjoyed this and are inspired by what's possible and what it takes. Please join us again for another episode of Wired for Change.